Well, there's no perfect time, but we prefer to see patients earlier rather than later. Generally, what you find is that in young patients, there's a few things that can go wrong. There's a few things that we need to treat early, but by and large, most things don't need any active treatment and can really just be reviewed by us, usually on a 6-monthly basis. We normally review patients, and what we generally do at the practice, which I think sets us apart from other practices, is that when we see a patient once, we will monitor them and we will see them for checkups every 6 months, but we don't charge for that. We'll review patients for a number of years before we initiate any active orthodontic treatment, if it's needed at all. We tend to let growth take care of most things. But in saying that, there are a few things that when patients are young that do need to be treated, and often the dentist and the dental therapist will pick up on that and will refer you on to us for those reasons.
I think if you're watching this video, you're probably thinking there's a problem either for yourself or your child, and you're wondering, should something be done now? I think if you've noticed a problem, if you've noticed any wear to your teeth, if your dentist has said there's a problem, you should really ask the dentist, if it's a dentist treating you, to get a referral to come and see Super Smiles. Or if you haven't got a dentist, that doesn't matter. We will still see you anyway. And look after you. The reality is, as Ray said, is that once we see you, if there's an urgent issue, we will do something. If there isn't, we keep you under a checkup regime of every 6 months or a year, but we don't charge for that. We just want to look after our patients and monitor things. For the young children, it could be asymmetry developing. The face could be getting crooked because of a crossbite at the back, and where the jaw's too narrow, upper jaw's too narrow, and the lower jaw has to move left or right to bite. And if you leave that long enough, that child will end up with a facial asymmetry the rest of their life. It's good to get that sorted out. And if there could be a tooth growing in the wrong direction. With an adult, I think if you're being told there's a lot of crowns or bridge work or major restorations to be done, have a look get the dentist to look at your bite and get the bite fixed properly, because there's nothing worse than seeing a patient who's spent thousands of dollars getting fillings and crowns and bridges, and then they get sent across to fix their bite. It's the wrong way around. So if you're looking at anything comprehensive, you should get the orthodontic opinion at least first before you actually pursue that path. It could be very costly not to do that down the track, and it's a lot more painful as well if things are done incorrectly. So we're always happy to give our opinion and give people the best advice so that they're left with the best treatment decision at the end of the day.
And young patients, particularly habits that they perhaps have, like a thumb-sucking habit, if that carries on, particularly as they get to 8, 9, 10 years of age, that can have a real effect on their teeth and on their jaw structure. So it's something that needs to be stopped, and we have an appliance that you can put in the mouth. It's very simple, it's very small, and it actually stops that habit instantly and prevents that from being an ongoing issue as they get older. The same with the jaw growth. If their jaws are growing, particularly if the lower jaw is growing forward of the top jaw, huge issue, and it's something that really needs to be looked at when they're younger rather than when they're in their teenage years. One of the other questions that we often get asked is, what about the timing of treatment? When should we begin treatment? And generally, if it's just a conventional normal patient, we try to treat them when they're going through that pubertal growth spurt, when they're going through that big facial growth change, and that's where we will achieve the best outcome, the most stable outcome for them long term.
Yes. Yeah, but if you're an adult patient, the good news is that orthodontics has never been better. It's such an aesthetic business now. It's barely noticeable. It's very comfortable. And if you've always wondered about getting your bite fixed, your teeth fixed, your smile fixed, it's a great time to do it, and we're happy to help out. And we can do it really nicely, very comfortably for you, without dragging it on for years and years. So if you see there's a problem, it's the right time to come and see an orthodontist. And at Super Smiles, we're happy to look after you, and we've been doing this for thousands of people over 25 years. So.
One further thing that I often get asked about is extractions of teeth. People get fearful about having to have teeth removed for orthodontic purposes, and largely, if we looked at our practice, particularly over the last few years, I think most of the time, in about 75–80% of cases, we don't need to take teeth out. You can simply just get the teeth in a perfect position. There are cases where there's extreme crowding. There's no way around that, unfortunately, unless the teeth are getting pushed out of the bone, which causes other problems. So there are cases where you certainly need to have teeth out, but 80% of our cases, generally,
Yeah.
we don't
Definitely.
need to do that.
And if you're a parent watching the video wondering what to do with your child, if your dentist has noticed there's a problem, ask for a referral because if you want specialist quality treatment, you really need to see a specialist, and your child will be the best off in that scenario.
Mm.